Thank you for coming tonight. It's a Functional Medicine Discussion Group. I'm Dr. Ben Weitz. Please consider coming to some of our future events. Nalini Chilkoff will be speaking on May 23rd on food and the physiology of cancer. June 27th, Dr. Elkin will be speaking about preventing heart disease. July 25th, Denise Weisner will be speaking about fertility. Please check out my Rational Wellness podcast on iTunes and YouTube. And if you go to my YouTube page, we also have videos of previous meetings. Let's see. Also, we have a closed Facebook page, the Functional Medicine Discussion Group of Santa Monica, so we can continue the discussion afterwards. So consider joining that. Many thanks to Metagenics for our sponsor, for providing us with some great food, and for sponsoring the venue. Our topic for tonight is autoimmune diseases with Dr. Holly Lucille. As you know, autoimmune diseases are on the rise, and we now have at least 100 autoimmune diseases and a number of other diseases that have an autoimmune basis, including now IBS having an autoimmune origin. So according to Dr. Tom O'Brien, autoimmune diseases are now the third leading cause of death in the United States. We're very honored to have Dr. Holly Lucille. She is a very prominent naturopathic doctor, registered nurse. She's nationally recognized educator, speaker, natural products consultant. She has her own podcast, Mindful Medicine, and she's written a number of books, and she's in private practice in Los Angeles. Thank you, Holly.
Thank you. All right. So, are you speaking to this? All right.
Yeah, so one more thing. If you want to ask a question, Holly's going to start with about a 30-minute presentation, and afterwards we're going to open up the discussion. And when it comes time for the discussion, if you raise your hand, Kristen's going to bring a microphone so everybody else can hear you. Thank you.
All right. Dr. Weitz, thank you so much for all that you do. Keeping this community together, and your podcast is great. Did anybody hear the Rational Wellness podcast that we did on autoimmune disease? No. All right. So you have to listen.
Shame on you. That's
Yeah.
your homework.
No, but it was interesting because he asked me how I got into treating autoimmune diseases, and I had mentioned that, as a licensed practitioner, I'm accountable for so many continuing education and all that stuff. But what informs me most is what?
Patients.
My patients. They do. They teach me the most. And these days, you got to keep up. And let me tell you something. As being almost in 20 years of practice at this point in time, use the least invasive methods to diagnose and treat. The things that I used to be able to do a couple decades ago, 15 years ago, even 10 years ago, it's not that easy anymore. There are so many more contributing factors, so much going on, and what I start to see is a tremendous amount of my patients have autoimmune disease. Either they come in with them and or I am diagnosing with them because I'm looking for them now. What I think that is really important for us to understand as functional medicine providers, so who do we have here? I'm an ND, all right? I started out as a bachelor degree nurse, went into holistic nursing, and I was like, yeah, this is it. Reductionist medicine was never my way to go. My parents were both pharmacists, and that's what I learned from a very young age. And then nursing, I was like, I'm still underwhelmed. And then I found holistic nursing, and then I found naturopathic medicine through that. And I was like, yes, thinking through things, more comprehensive ways of understanding and remembering physiology and biochemistry and influencing factors. And I was like, this is exactly what I want to do. So who else do we have here? DOs, MDs, clinical nutritionists, you name it, right? So this I think, I think that we're talking about autoimmunity, but this is our jam. This is our way of thinking about things. This is the matrix. Whether you call the matrix through functional medicine training or the therapeutic order, this is exactly what we were meant to do. But this whole category of disease has changed my practice. My model, and if you look at my website, which I need to change because people have been calling me out on it, is I want to get people to not need me. That's exactly what my goal is. And that's what I used to be able to do. Maybe an initial visit, perhaps a follow-up for sure. And for the most part, get people back to what they were doing, give their health back. Get them closer to their healthcare desires and just go get them. These days, it's just not that easy anymore. And I am spending more and more time thinking through things, running more elaborate testing, understanding, trying to put the dots really close together so that we can connect them. And a lot of it has to do with what? The autoimmune disease. Why do we think that it's on the rise?
Lifestyle,
Toxins.
environment.
Yes. That's why I say this is our jam. It's all of that. But I do think that it's pretty amazing that, I think since 1990, there's over 100,000 chemicals that have been introduced into our society. So I think we have to take a look at the environment. Definitely women are being more affected. A couple reasons for that, we don't know them all. I want to say that excess estrogen induces an overexpression of estrogen receptors, which harms tissue, leading to autoimmune diseases. That's one thing we need to keep in mind. It's another thing we need to keep in mind when we talk about hormone balancing and also detoxification, because how does the body look at estrogen for the most part? As a toxin. What does it need to do? It needs to metabolize it and get it out. If we have an overall body burden, if we have nutritional deficiencies that are not supporting the cytochrome P450 pathways of detoxification, what's happening? Those tissues are being stimulated, estrogen receptors are being upregulated, and I think that's a contributing cause, perhaps, why we're looking at this being more of a woman issue than men. Also, testosterone reduces the number of beta cells, which do release harmful antibodies, and so more testosterone, we have that decrease in beta cells. So that's just something to look at. And then I think there's the X chromosome and genes that are associated with that. I have been getting more and more into genetic testing, especially when it comes to autoimmunity, because it's just starting to make sense, and I'm starting to get better outcomes in my practice, and so I'll touch on that a little bit as well. Certainly, like I said, a bottle of water. Dramatically over the last 20 to 30 years on the rise, 50 million Americans affected. Researchers have identified over 80 different autoimmune diseases. I'm probably going to touch on just about 3 or 4 of them.
There's some EPA for you.
Thank you. Nice BPA. You do what you can, right? And it's costing everybody a lot of money. I mean, from the insurance industry, yes, of course, and we're going to talk about this because let me tell you something. When we get into here, take this medicine, like the medications that are on the direct-to-consumer commercials that everybody's seen, if you've got rheumatoid arthritis, if you've got any autoimmune disease, it's pretty amazing. It's very expensive. I have been getting into cases where people do not pay me, as I said on the podcast, to mind their pocketbook, but there has to be additional testing sometimes. We need to identify and treat the cause. I am a naturopathic doctor. I'm always going to go back to my principles. I'm going to try to use the least invasive methods to diagnose and treat, but I'm always going to come back, though, if your antibodies are not going down, if you have a Hashimoto's, what is in the way? We have to understand what is in the way. We have to honor the fact that the body has an innate ability to heal itself, and if it's not, we need to understand where are their deficiencies, where are their excesses, what is in the way. And I'm always going to be able to use my critical thinking in that process, but I also, at this point in time, with everything that's available, there is data out there that we can extrapolate by doing some testing. Is it expensive? Functional medicine testing can be. So it goes into the education part, I think, when it comes into dealing with tough cases when it comes to autoimmunity. So genetics, infections, toxic chemicals, dietary components, all of those things that you mentioned, all of it play a role. And it's I think about the idea of a standard of care. Everybody's heard that in their practice, right? Whether you're an MD and ND, a standard of care. As NDs, we kind of think about what is the standard of care if we're treating lupus? What is the standard of care if we are treating? I have been thinking about this quite a bit. And I actually am going to sort of drive away from the standard of care. What I actually am more concerned about is the standard of assessment. I have a colleague that is solely treating autoimmune diseases using homeopathy. That is not what I'm doing. That is what he's doing, and that's great. And he's actually getting quite good results. That is not my lane, okay? But I think the standard of assessment is, once again, where our jam is, where we can understand these comprehensive influencing factors when it comes to infections, viral, bacterial, fungus, Lyme disease, co-infections, with tick-borne illnesses, heavy metal toxicity, dietary components for sure. Yes, when it comes to digestion and leaky gut, or how I like to say it, hyperpermeability, which is sort of a fuel for autoimmunity. We're going to get all into that. But all of it plays a really important part, and I think that the assessment is where the sweet spot is for us. So what is it? I always have said, I kind of detest diagnosis. I think it gives us a great language to speak to one another, and we can certainly code insurance forms and such, but what's the mechanism behind the diagnosis? What is the pathology? What's going on? So this is, of course, where the immune system inappropriately is attacking the body's cells. It can happen to a variety of tissues. Each individual situation is different, and I know that from my practice. Yes, it comes with an ICD-10 code, but we have to look deeper into that cause. And the areas of concern that I'm going to include, but not limit ourselves to, is the inflammation and immune balance, very important. Digestive health, that's where we have to start. Detoxification, and we cannot leave out the HPA axis. Once again, why I say from a functional medicine perspective, this is our jam. This is what we do. So I think it's important too, what's most devastating is the patients that come to me from seeing their Western reductionistic conventional medicine doctors and them being undertreated for their condition, is that if you don't address the autoimmune component of whatever disease that's been diagnosed, the autoimmune component continues to move on. For example, Hashimoto's. I've seen this so many times. So Ben and I have talked about this before, where Hashimoto's, so you have an underfunctioning thyroid, right? So TSH is elevated. And for me, I'm always like, well, why would an otherwise healthy 33-year-old woman have an underfunctioning thyroid? What's the difference? Like, what's going on? For their conventional medicine doctor, they just want to make sure that that TSH gets where? Within normal limits. And they do what? Standard of care.
Right.
Synthetic T4. And that's it. So most of it, 90% at this point in time, 97% maybe, it's an autoimmune condition. But I've had this conversation with esteemed endocrinologists, and they will continue to tell me that they're not going to run thyroid antibodies. Even if I say, well, why would not you do that if it's, it is the leading cause of hypothyroidism? Because they're not going to change their treatment, right? That's really important. And then I also have to teach my patients this, like, don't get mad at them, because my patients end up being mad at the practitioners that they're saying, like, that's not their lane, that's not their scope of practice. We have to get a second opinion. You have to be empowered from your own health, because it will continue to attack other tissues. And what I've seen with Hashimoto's especially is the ovaries being next. So I get women who are undertreated with Hashimoto's that end up with premature ovarian failure, early menopause, because when we don't have a test for this yet, but their ovaries are the next gland that autoimmune condition actually takes hold of. So extremely important. So truly, it's like pick an organ, any organ. It can affect any area of the body. What's most devastating, once again, is that if we do not address the autoimmune component of it, and where is most of our immunity? It's in the back. So let's just go over a little bit of the immune system refresher. And thank you, everybody, for remembering last year when I was here that I was very ill. And I'm not this year. I was very ill, and I called Ben from my bed at about 9 o'clock in the morning. He's like, you have to come. And I did. All right, so, the way that I think about the immune system is the way that I think about the entire body. There's always a balance. It's working brilliantly. There's, something that happens. There's that comes in. The immune system is kicked off. It addresses the imbalance, or it goes and fights it, and then it comes back to balance. That's what we're supposed to do. It's the goal. When any system in our body, homeostasis is easy. Now, what I think is really important in this factor is that the external factors that are affecting the immune system, once again, we've got microorganisms, right? Bacteria, virus, fungi, parasites. We've got multiple contributing factors. Our air quality. Ben, what did you just post on the group about, it was yesterday, right? That more people are
Exposed to air pollution.
yeah, so we had a decline, but then it's also on the rise again.
Yes.
Yeah, and I read a study as well that the air that we breathe and the pollution that is in particularly this city is worse than smoking 15 cigarettes a day. Yeah, so there's particulates, so all of these things we have to take a look, because my approach to autoimmune disease is very aggressive. We have to look at all of this. Water and food quality, extremely important. Like the entire, I'm probably going to say brand agnostic as much as possible. Do we need to get in there and heal the gut and do the 4 Rs and all that stuff? Yes, but all of these lifestyle things, decreasing exposure as much as possible, all of these things have got to be on board, because I've seen people with deep autoimmune diseases, 1, 2, maybe 3 different diagnoses, try to get away with, yeah, well, I wanted to spend time with my granddaughter, and so I had a piece of birthday cake. It does not work. You have got to be full bore. Life stressors for sure. And so we have to think of all of that stuff. So internal factors which affect the immune system, I want to go back to the HPA axis. Sometimes I feel like this is a little bit disregarded. I know we think about this quite a bit in things like adrenal fatigue, or what I call over-adaptation. But this has, I think, a huge issue when it comes to autoimmunity. And once again, it's either stress or the perception of stress. And these days, I think we have an autonomic dysfunction where the sympathetic nervous system is so on fire that we have a really hard time actually getting into parasympathetic, that people can't even sort of slow down and get into that rest, relax, and repair. It's almost impossible. Digestive health we're going to talk about quite a bit, and then of course detoxification. So what do I see clinically for the most part? You name it, joint pain, muscle pain, weight loss or gain, insomnia, cold, hot, recurrent rashes. That's a big one. I had a woman come in just the other day on Monday, actually, big rash right on her chest, and we are doing a full-on workup, because just from her history and what she's telling me, and you can almost see it these days, I know she's probably going to come back with, I think she has autoimmune thyroiditis and probably lupus. I think that was like a lupus sort of initiated rash. But symptom presentation is sort of a classical path to diagnosis. The problem is that each of the symptoms can have a variety of underlying causes. And in the conventional world, what we're trying to do mostly, what they're trying to do is just mitigate the symptoms. But once again, this is our jam. We have to go deeper and identify and treat the cause. Or like I said, this whole thing, as the fire sort of progresses. This is actually somewhat of a standard blood workup. This is what I would start doing. I just kind of threw this in here. This is a slide from Todd Bourne, who I saw at the CND Emerging Medicine called Cells Gone Wild. But this is pretty much exactly what I do. So standard testing from a blood perspective, Cyrix testing here is really important, inflammatory markers, hormones for sure. We got Dr. Mike Carriger in the house, the hormone specialist that you heard talk last year. But the optimization and balance of hormones, incredibly important in all autoimmunity, something, once again, a whole category on its own, but we're talking about making sure that estrogen is being detoxified appropriately, is being metabolized appropriately, that androgens are up, that DHEA is not low due to the HPA axis being overridden, that progesterone is not low due to the HPA axis being overridden. All of those things are extremely important. Micronutrient panels are extremely important. We've got SpectraCell in the house tonight. All of these things, and then of course I just try to code correctly so my patients have, so these are some of the ICD-10 that I do use in order for them to have the least out of pocket as possible, because once again,
the first code there sounds a lot like my practice, zoo.
Yeah, and yeah, exactly, that's a good point. So advanced testing, of course, we're looking for, I have a really complicated case, and like I said, this whole category has changed my practice, of a 37-year-old man who, he presented as a 17-year-old, cold sweats, loss of appetite, weight loss, the whole shebang, Mayo Clinic, nobody was able to figure out what was going on. He has survived. He was diagnosed with Lyme. He has been treated for 2.5 years. unresolved, in my opinion, and came to me because one of my interns actually said, you should go see Lucille because he had a return of symptoms. 37-year-old, very prolific woodworker, wood designer, furniture designer here, and tested him for immunoglobulin deficiency, which he has because he has EBV off the charts. He has Lyme and co-infections still. He doesn't have an immune system to take care of these things. I tell people, dossier, right to teach. So I'll say, hey, if you ever take a microbiology class, you can swab this, BPA plastic and put it on a petri dish, and stuff is going to grow because we live amongst viruses and bacteria and fungus, but we have this incredible immune system to be shh, I got this, right? We are on par. I'm going to take care of you. I'm going to keep things in check, including cancer cells, right? And so if you're immunodeficient for a myriad of different reasons, that's an opportunity as well. And so we want to test for those things. Stool microbiology testing, GI mapping, the microbiome, another category that we could talk about, another night. The SIBO testing, that has been, of course, on the rise because we're more aware of it. And really important, but once again with SIBO, we have to identify and treat the cause of why those bacteria are up there. Heavy metal testing for sure. Mold testing, absolutely. So some of these things, I know we're probably going to get questions, but Vibrant America is a lab that I use. They've got the Weitz Zoomer, NeuroZoomer, Cyrix Labs, the mycomedics.com. Is something that I use, and also Genova. I've been using them ever since they were Great Smokies. But many different functional medicine labs that I'm sure you're all aware of do a great job at being able to assess this data and being able to pull all these things together. Genetics, I'll just go over this real quickly. The human leukocyte antigens, when it comes to more specific things, for celiac disease, Hashimoto's, of course, Graves' disease, and then Hashimoto's, we're going to definitely get those thyroid antibodies. Very important. Anybody who has low thyroid, I think these days we just have to understand what their TPO, which we can catch 70 to 90% of the time, thyroid globulin antibody probably more 70% of the time. And then, of course, IBD, we're starting to understand that has a genetic component and an autoimmune component to it as well. So there's some specific testing for that. As I mentioned, I just want to sort of throw this in here. This is a slide from Leah Holland. Once again, another event that I went to. I've been just starting to do a little bit more work with nutrigenomics and epigenetics when it comes to autoimmune diseases. GX Sciences is something, there's a panel that I use there, and it's people that present to me where they have multiple autoimmune diagnoses that they already come in with. I think it's helpful to know, and my friend Ben Lynch, Dr. Lynch, he wrote the book Dirty Genes. It's not so much that we have to pay attention to the SNPs, and directly understand that, hey, if you've got this, single nucleotide polymorphism or this variant on this gene, that we have to fix it. But a lot of our genes, because of our lifestyle, because of our environment, are sort of dirty. And through lifestyle interventions, through dietary things, we can actually clean those up and encourage the enzymes that do have variants. Because yes, we cannot change what DNA of anybody, but we can change the phenotypic expression of these genes. And that's what's so important. And we can do that through epigenetics and nutrigenomics. And so another thing that I want to mention, histamine, people having a hard time processing histamine. And with the DAO gene, I've seen very high in some studies in people with rheumatoid arthritis and other autoimmune conditions. And so that's another thing that we want to keep in mind. So just quickly, we'll go through Hashimoto's thyroiditis. Like I said, you can't really treat lab tests. You have to treat people in this area. Once we've got an autoimmune thyroiditis, it's not really a numbers game anymore. If you, and quite honestly, and I've seen this many times in my practice, if you catch this early, because you've got at the thyroid level where the thyroid T4 is kind of a pro-hormone, we've never really understood a receptor site that T4 has, so it has to be converted into, of course, active T3 and reverse T3 or what have you. But if you catch it early, because there's about 4 months of stored T4 in our thyroid, and the thyroid gland starts to be attacked by these antibodies, it actually is Graves' disease. And I've seen this happen clinically, where people get hyperthyroid and they have symptoms to correlate with that, but then after subsequent attacks, it starts to be diagnosed finally, because they get sluggish and they have all of the different symptoms that go along with what we know as low thyroid. So also systemic lupus, something that I see all the time, oral ulcers, arthritis, photosensitivity, renal involvement here, anti-nuclear antibodies, always run an ANA on folks, I think is extremely important. When people have a positive ANA, think about it. It's a positive anti-nuclear antibody. What is that antibody doing? It's attacking the nucleus of our what? Cells. In where? Every part of our body. And so this is something, and I have had people over and over and over again come in with a positive ANA, but no other criteria for their conventional doctors to diagnose them with anything. And so they say that they're fine. But guess what? They're not. And they don't feel fine. And they don't present fine. And that's where we have to continue to understand what's going on, because I think diagnostic criteria at that point in time is very limiting. But if you've got a positive ANA, there is something going on, and it's our job to figure it out. Rheumatoid arthritis, I've got a woman right now, she's got she's just advanced stage rheumatoid arthritis. She's got Hashimoto's thyroiditis, and she just got diagnosed with breast cancer. Is it all connected, do you think?
Yes.
Yeah, I think so too. So we are taking our time. She's actually the one that called me out, because my website is like, I'm going to try to get you not to need me, and like, I don't want to overtreat you. And she's like, she almost didn't come to see me because she was like, I've had this happen before. I need help. I need somebody to stick with me through this. And I was like, no. I didn't mean to say that. Here's what I really meant. And I had to kind of just call her and say, listen, completely up to you, but here's what I meant. But I understand where she's coming from. She's been kicked out before. She doesn't want to take the road that her conventional doctors are prescribing for her. She wants deeper help, and so we're going to hang in there together. But once again, tons of things that we need to understand when it comes to this diagnosis as well. And so I just think that it's time for looking at this through the pathways of inflammation and autoimmunity just differently than the direct-to-consumer commercials that our patients are seeing every single day. If you've got autoimmune psoriasis, or if you've got anything, they'll grab you, and the butterflies will be flying, and that music will be playing, and they'll be telling you that if you take this drug, you're going to die, but it is there for you. So it is time to definitely identify and treat the cause. So let's just take a look at this quickly. And I know I'm preaching to the choir for a lot of this stuff. You know that inflammation is definitely a normal process. When it becomes a problem is when it's out of balance. And so cytokine balance has a strong link to both healthy immune responses and autoimmunity. It is all about balance. I say this all the time. I don't think there's any bad cholesterol. LDL has a very important function in the body. It's about being in balance with the other lipid markers, right? I don't think there's any, omega-6 isn't bad either. If you look at and remember your biochemistry, and omega-6s have a huge, role in the body. And you can be omega-3 toxic, and I've seen people do that, where they have brain fog and painful joints because they're, eating salmon and taking fish oil and having flax seeds and not having any vegetable oils whatsoever. Their omega-3s are all the way over here, and omega-6s. It's all about balance, and when it comes to autoimmunity, our immune system has to be there as well. It just gets triggered in a sense where it completely goes out of balance. So this is very important. This slide is extremely important. The Th1, Th2, and Th17 are the T helper cells which result in the production of cytokines, are inflammatory cytokines. Th1-mediated cytokines, generally seen as what? Those are the ones that are up and amped up when it's pro-inflammatory. I have them listed there for you, and yes, I do test them. Th2-mediated cytokines are generally seen as anti-inflammatory. Yes, I do test them as well, because the Th1 and Th2 balance is extremely important when you're looking at autoimmunity. The Th17-mediated cytokines implicated in the pathogenesis of most common autoimmune diseases, and the increased Th1 family cytokines are common finding in autoimmune diseases such as lupus, Hashimoto's, arthritis, and other autoimmune-mediated diseases. That is what you'll see. You'll see those Th1 all the way up there, being the pro-inflammatory ones. Are there things we can do to balance this? 100%, absolutely. But this is where the sweet spot is. This is what we have to figure out. Is it diagnostic solutions that we talked about?
Yeah.
that runs the Th1, Th2.
Right.
Yes.
Cyto-DX test.
The Cyto-DX test, okay. So once again, relatively decreased in autoimmunity are the inhibitory pathways. Relatively increased in autoimmunity, the co-stimulating of T impacts, but look at the middle. What are the factors that influence the balance? Our genetics, slightly, I would say, yes, important point, and I think it's getting more and more important, but our environment and our ability to come back to homeostasis. Homeostasis is something that I have almost lost track of. Do you know why? I just don't think it existed. I really don't. So Robert Sapolsky wrote the book. What was the book? Why Zebras Don't Get Ulcers. And he turned me on to this word called allostasis. And allostasis is the body making, or the brain, I should say, making body-wide changes in the response to something that's chronic. That's what allostasis is. And in my opinion, that's what I'm seeing all over the board. I think our brains are starting to shift and going, oh, we're not going to come back into balance. I get it. I'm going to make some changes to support that, to help you, because this isn't normal. But I'm your pal, and I'm going to, keep working on your behalf until you kill me, which some of us are doing. But I think that's what's going on. So it's this allostasis that's happening, and the homeostasis part just is so rare to come by. But that's what we're going to work on. Detoxification, once again, I am preaching to the choir here, but it is an important part, because what is more, nutrient dependent than our detoxification pathways? Maybe our thyroid function, but detoxification is so extremely important. If there are nutrient deficiencies subsequent to malabsorption issues, subsequent to leaky gut, hyperpermeability, etc., we are going to be in trouble. So important to understand. Toxins enter through the lungs, the skin, all of this, and we've got to open up the emunctories, support these pathways, and of course get them out. Perspiration, I would say defecation, urination, emoting also. I don't want to spend a lot of time on it. I know that, when you think about autoimmunity in and of itself, think about, hey, why are you attacking yourself? There is that component that once things settle down and we can get people feeling better, I'm not going to rush into a mind-body session on why are you attacking yourself? But because people probably would leave because they're not feeling well, but it is part of that. So extremely important to understand, and I think emoting is also a great way of detoxification. And so once again, understanding that there is very nutrient dependent. And this is where these juice fasts that everybody are into, I just don't think cut it. When it comes to proper detoxification, we have to continue to understand where the overload is, where there are potential deficiencies, and still take detoxification very, very seriously. I think sometimes detox or fast or things get very connotated as being popular or kind of fatty, but when it comes to our scientific practice, very important to understand if this is happening. And once again, I said, especially women are being affected more with autoimmunity. We have to look at that estrogen dominance effect. I think that's extremely important. The HPA access, preaching to the choir. All right, so women, 28% increase in headaches, 40% increase in muscle aches and joint pain, 50% reduction in immune cell activity, and 50% increase in the risk of heart attacks and diseases. Once again, the HPA access, I think, is extremely important. I wrote a letter for the Townsend, an article for the Townsend letter, and I got a lot of flack for it because I said adrenal fatigue doesn't exist. And what I really meant is that I think that we should be consistent in the literature, and that it's more of our ability to, what do we have? We have the ability to adapt, right? And I think what HPA access dysregulation really is our over-adaptation. We've kind of had enough. And so there are confounded, continual stressors in our modern day that affect people all the time. The stories that I hear, certainly not, in my practice, but I go through it myself. We all do in our modern day. I took a lift here because I was like, I didn't want to drive. I was thinking to myself, I'm like, oh God, I'm too old to drive. In traffic when stressful. But I literally thought about, I do not want to tax myself in that way. You know what I'm saying? So I literally, Mike will probably take me home. That's not happening. He's got plans. I lived in home as well, which is fine. But it's one of these things that I think is really important, and here's why. This is what I really want to bring up. The chronicity in the stress response results in a variety of problems, one of which is dysregulation of our immune response in the final stages of HPA axis exhaustion. And the response of our immune system is blunted. This is where you see the immunocompromisation. This is where that immune response does not at all respond as it should. It's over-adapted as well. And that is a problem. I just want to highlight, I had a patient come in the other day, and she couldn't get in to see me, and she's an existing patient, and she had fallen off a regimen after she was doing really well on, but right, what we do is not easy medicine. Here, take this as easy medicine. If you go to your doctor and they prescribe a biologic or what have you, and you fill it at the pharmacy, and you pay your copay, and you take off the top of that bottle in the morning, and you take that medication, that is easy medicine. Period. It's done. That's your care. When you are asked from us to do lifestyle interventions, dietary modifications, evidence-based dosage, hopefully, supplementation across the board, it's not easy medicine. It just isn't. You gotta get skin in the game. And so she was doing great, and she communicated to me and was so thankful. But not being easy medicine, her having a very busy life, 2 kids, writer, having to go up to Vancouver every so often, she fell off. So she went to a doc in a box. It was like in a strip mall, and they gave her an IV of something, and then they gave her, without doing any testing whatsoever, armored thyroid and an increase in testosterone. They didn't test at all. Here is why I had a hard time with that approach, and I'll tell you. If you are in catabolism, and when people are here, right, from an over-adapted state, and your ability to grow and heal versus your ability to your wear and tear, all right, with your glucocorticoids firing off, is skewed towards wear and tear, and you increase metabolism with thyroid, what are you going to increase? You're going to increase your ability to wear and tear, period. And people will feel fine and okay for a hot second on that thyroid, and then guess what happens? They don't. So they go back, and guess what they do? They increase the dosage. So it's just something that I'm sensitive to and I want to be careful about, because if somebody is on the trajectory of wearing and tearing, and we try to give them more energy by increasing their thyroid, it's just ultimately going to make them worse. And this is just something that I think about all the time. And this is what I try to dossier teach this patient. Okay, and then our big thing. Leaky gut as a danger signal for autoimmune diseases. Once again, leaky gut, yes, our patients know it as that. We call it hyperpermeability. We've got, where do we start? Intestinal inflammation, nutrient malabsorption, immune response. We've got, what is in our gut? Our gut-associated lymphatic tissue, our mucosal IgA, our probiotics, our whole microbiome that informs everything that our immune system has to do. And so this is definitely, I think, where we need to understand. Because when this barrier breaks down, antigens are allowed to flow into circulation, setting the stage for immune reactivity in a variety of tissues throughout the body. This is what happens. Those tight junctions, they just get, they just get weak, and they get a little bit more loose. And so you've got larger protein molecules of whatever kind getting into our bloodstream, and what happens? The immune system's like, hey, you're not supposed to be there. And so it starts to attack, and I think this spurs off the confusion. It's important to understand, I think, that each of these things, I'm just going to go over quickly, it is so important to address. Once again, as an HPAThic doctor, my goal is always to understand and identify and treat the cause. Extremely important. These are complicated cases. We have to do it all. From a lifestyle perspective, yes, I don't know, another whole entire evening could be spent on circadian rhythm and sleep and why we're having such a hard time. Do any of your patients have a hard time sleeping? There's a raise of hands. Yeah.
Everybody.
Yeah, I think everybody, right? So it is incredible. And there's many things to look at there, but I think it is an important thing to assess. Once again, we have that cortisol-melatonin connection, and there are sleep aids that people are using, but are they sustainable? THC is one of them that are out there. I think the edible gummies have been turning on a lot of people, but they're starting to not work, and they increase the dosage once again, and they're firing off those CD1 receptors in the endocannabinoid system, and so we're getting another whole host of a vicious cycle going on. And so lots of stuff to keep in mind, but definitely working on an appropriate circadian rhythm and sleep is important for these folks. Stress management, once again, preaching to the choir. It is all about, this is a woman in traffic. She could have been driving here tonight, unlike myself, having the time of her life singing to Pearl Jam, I'm sure. But I decided to lift. But just another thing that I wanted to throw in there. And then, of course, this is the huge part. We have to understand and reduce exposure as much as we can. Once again, 100,000 different chemicals introduced to the United States since 1990. There's the entire thing of molecular mimicry. Anybody heard of that? Yeah, so, our bodies are getting so confused at what's coming in, especially if there's a hyperpermeability issue, which there usually is 100% of the time in autoimmunity. And so we've got viruses, bacteria, Lyme and co-infections, electromagnetic fields. There's a whole list of studies coming out as far as EMFs and how they're affecting our immune system. Always, I go through and I learn, once again, through my patients, I can't believe, and sometimes I shock myself because I don't do it, doesn't mean that everybody else does or does not do it, but the Teflon pans that people are still using.
Oh, it's so bad.
I know, but do you think that it was like, what are you doing, living under a rock? Like, why are you still doing that? And so I have to catch myself, but yeah, the PFOAs from that, the amalgam fillings, have to ask about that. Mercury, the amount of people that I see where I know I have a plan to get those auto antibodies down, and something's going on, and once again, I'm like, something's in the way. And when I test those heavy metals and mercury's off the charts, and we do the job of detoxing from mercury, those auto antibodies have a chance to start coming down now. Happens too with HPV. I have a pretty solid track record of clearing HPV. One woman, green tea suppositories, the whole shebang, and she was on it. Positive HPV every time, positive dysplasia every time, like something's in the way. Mercury, once we detox from mercury, guess what? Her HPV cleared. So all these gnarly things we have to take a look at. Diet. All right, so this is a really important thing. There are so many different diets out there. As you well know, the paleo diet, the AIP, the glyphosate definitely, I think, opens a gut barrier, affects the microbiome, opens our brain barrier. I know we've talked about leaky gut, but there's leaky brain that's being written about. There's leaky heart that's being written about. In my opinion, there's leaky bladder. We can all apply that same sort of concept to all of those things. So really important, we all know this, but I think when I come with these patients, no grains whatsoever. Because people that go gluten-free, they get themselves into trouble with all the gluten-free products out there. And it's just, this is my thing, no grains whatsoever. Not for the first 60 days. Had a lot of success with the Paleolithic diet, of course, the paleo diet. There's also, there's something called autophagy that I think is really important that we start to consider, and there's some testing that we can do about that, genetically wise. But intermittent fasting, we should always consider as far as having those cells clean themselves out, decreasing the inflammation, important. I think the keto diet is pretty strong. There's some evidence, that it increases beta-hydroxybutyrate and BDNF, which of course it decreases inflammation, and inflammation is the source of our autoimmunity. There's the Swank diet, there's the SCD diet, there's the Walls diet, there's tons of things. And so, but this is extremely important, and eliminating triggers for each and every individual in autoimmunity, whatever it takes, dietary stuff is important. From a supplementation perspective, I mean, we could spend another 2 hours, 3 hours here. Foundational, certainly recovering any vitamin D deficiency. I am so tired of people bringing in their lab tests. initial patients, vitamin D is 24, they're like one click above rickets, and their doctor said they're fine. Not so much, we want that optimal 60 to 80, is still where I'm hanging out. Essential fatty acids. Probiotics, yes, contraindicated in SIBO diagnosis, we should take a look at that, but I do like Lactobacillus acidophilus, plantarum as well, bifidolongum and rhamnosus as far as what I get as core when I'm dealing with autoimmune diseases. Decrease in inflammation, so we have to think of curcumin, inhibits TNF and other interleukins, also supports the liver. If you look at curcumin and its molecular sort of, just all of the molecular pathways that curcumin hits, it's about 100. If you want to decrease the COX-2 enzyme, there's a COX-2 inhibitor, right? It's like, it does one thing. Curcumin, if you look at it, there's 100 different molecular pathways and that's why it's so incredible for so many different things. I really like this botanical quite a bit. So inflammation and immune support, I would say really important, resveratrol, and this is something I really brought in, lost my mouse. It helps to reduce oxidative stress, inhibits T cell differentiation to tumor necrosis factor alpha. This top presentation is the bottom is rheumatoid arthritis. This is the mechanism of action for resveratrol in lupus. So I've been using resveratrol pretty effectively when it comes to decreasing the inflammation and balancing out the immune system. The other thing too, are you familiar with Argentum 23, the silver product? Yeah, I've been using that with some great success as well. So that's something that I put on board. Okay, and here we go. The digestive component, I can't say enough about. L-glutamine, of course, it's a preferred fuel source for those enterocytes. Being able to do our 4 or 5 Rs, remove the antigens, re-inoculate with good bacteria, recover any nutrient deficiencies, and then, of course, repair that gut lining. Zinc carnosine, I think, is really important. There are different antimicrobials out there. Biocidin has a great protocol. I heard somebody talk the other day. He said that yeast, of course, when we breathe in oxygen, what do we breathe out? We breathe out a toxin, right? Carbon dioxide. So yeast, acetaldehyde, and they said acetaldehyde is probably one of the worst toxins ever. And so if there's a candida or a non-candida fungus overgrowth, dysbiosis, that has to be cleared up. Certainly removing that, extremely important. Correct anything like hypochlorhydria, any protein breakdowns that are not happening that you see high levels in stool analysis or high levels of fecal fat, I think is extremely important. And then of course our detoxification support. And then being able to, I would say in stress, at this point in time for me in practice, it's supplementing people's lifestyle. There are very few people, including myself, that can actually do the interventions of decreasing their stress. I had one patient in the last 6 months be able to take a leave of absence from work because I'm like, if you do not stop, this is all going to be like pushing sand against the tide. And so she was able to talk to her husband, get the kids managed, take a leave of absence from work, and do the work, because it takes quite a bit when we get to this point in time. And then of course, being able to sleep. So this is actually, this is something from the Autoimmune Recovery Matrix from Dr. Osborne. And I liked it because it's basically summing it up, right? Do you have autoimmune disease? Let's investigate. So are there vitamin deficiencies? Are there infectious pathogens? Do you have a gluten sensitivity? Food chemicals and allergies, toxic metals, gut integrity and dysbiosis issues, physical issues, emotional issues, and it goes on and on and on and on. And then yes, there are appropriate testing that can be done and should be done, and there are things that we can do to actually uncover the layers of this very complex issue when it comes to autoimmune issues. So that's that for the presentation.
Thank you.
Yeah.
And now that we're doing the Q&A, we'd like everybody to participate. One of the first questions I would have is, there's so much stuff to look at. There's so many things, so many triggers, so many possibilities. Where do you start?
So where do I start?
Is there a hierarchy?
Yeah, I think there is. And I think it's with that initial diagnosis. Like, I like to get inflammatory markers, I do. I do like to do that initial blood workup and concomitantly functional stool analysis. Like, I want to see if there are stuff growing at amounts that they shouldn't be growing at, and stuff that's undergrowing at amounts that they should not be, or undergrowing, you know what I'm saying? So those two things basically, and perhaps at this point in time, a third thing, and once again, people don't, you know, as I've said before, they don't hire me to manage their pocketbook, but I do whatever I can to start chipping away at the layers. So if we can tuck that blood testing under their insurance, I want to get as much information as possible. I definitely want to see about antigens, and then we go from there.
So when you say antigens, you're talking about food sensitivity.
Sorry, those food sensitivity. Right. Well, you know what? Well, and once again, when it comes to managing somebody's pocketbook, what I start people on, and I've had a lot of success, and I might get some flack from this group, but I will start people on, if we are initially working together, just when we're getting started, instead of spending their money on food sensitivities, because in my opinion, if you've got hyperpermeability, and you're doing, I mean, IgE testing is one thing, but IgG and IgA testing is another. If you have hyperpermeability, those things might be skewed, right? Because of that, you're going to fire off on those things. So what I'll do first, while I'm getting some other things checked off, is I'll put somebody on a modified blood type diet. And just have people, quote unquote, avoid foods and get their secretor status, because that's important. So one of the genes, FUT2, if there's a variant there, these are poor secretors. That means that they don't have the sugar secreting into the mucosal membrane that attracts the probiotics. So first of all, what is that? That is, in my opinion, a setup for autoimmune conditions. And they're always going to need pre and probiotics. And so that is part of the prevention, if we know that. But, yeah.
Yeah, of course, starting with the gut is always super important.
Huge. And then so just, I'll put them on a modified blood type diet, and then we can do food allergy testing later if needed.
Yeah, or you can do elimination diet.
The elimination diet, which people are so fond of. Just kidding.
You're going to start with 5 foods now.
Yeah. I mean, it is. It takes a long time, and people have to sort of set their lifestyle up to avoid those foods and reintroduce them. And it sounds great when you say it really fast, but I think that I've had a hard time with kind of adherence with that approach. But it's lovely.
So you mentioned heavy metals, and we're all getting exposure to heavy metals to some extent. What's your preferred testing for heavy metals?
Yeah, so I like the if we can do it cost effectively, the NutriEval from Genova, because it has that heavy metal portion in there.
Yeah.
But it also has so much other data. So if I'm going to go for that, I'm also interested just to see what else can come up. There's a particular toxin, MTBE, that is in. It's kind of like it's like a gas.
Gasoline.
It's gasoline, right? So very common in tap water. And I had a patient, high antibodies, doing everything, can't get them down, very high. So I said, you know what, just have the gas company come out. Because they were like, no, we have a filter. They actually use a Berkey filter, which I think is one of the best sort of home water filter agents. And so not in her condo, but in the hallway, there was a gas leak that was coming in non-stop to the room that she works in, that she does her yoga in, that is basically her sort of home office room. And so that was an interesting finding. So I do that.
So how did they block that leak?
I have no idea.
Oh, okay.
Yeah. I mean, I think they fixed it.
Yeah.
But yeah, reducing exposure by all costs, especially if we find it.
Do you see mold in some of your autoimmune patients?
Yeah.
Urine testing?
Yeah, so real-time
labs or Great Plains?
It's Great Plains, great for those things, yeah, definitely. And sometimes, we get to the point where we treat as if, right? So if it's smells, walks like a duck or talks like a duck, it might be a duck. And so, and a lot of these things start to come together. So we don't have to have, this extensive testing, especially if it starts to get too expensive. We just kind of treat as if.
What do you do when you have a patient who comes in who's on immunosuppressant drugs, and because they have a diagnosed autoimmune condition.
Yeah. So I do a lot of education, because what are we scared of when we're on immunosuppressant drugs?
Infections, cancer.
Yeah, infections and cancer. And I would say cancer more than that. And so a good amount of education, a good amount of support, because I can't just say, hey, this is the way to go, this is not the way to go. So getting their buy-in and having that education is really important. Yes, sir.
Thank you for a great presentation.
Do we have the microphone?
Here's the money.
Oh, okay.
I'll talk loud. So I'm an integrative cardiologist, so I'm not a specialist in autoimmunity, but believe me, it's there in all my patients. But my big deal is detecting inflammation and dealing with it. So I do a lot of certain markers, Boston Heart, now the Quest Lab, Cleveland Heart Lab. There's a whole list of different markers, there's the radio labs. And that's what my big deal is. And then I'm interested that, like when I check for autoantibodies, a lot of people think, so what's the autoimmune antibodies are like 300, it's not a big deal. Or I've spoken to rheumatologists when I do my inflammatory workup. Say, well, the ANA is like 1 to 80. I said, that's nothing. 30% of the population has that. But that doesn't mean that 30% of the population is normal, right? So that's my question to you. But that's what your traditional rheumatologist will tell you.
Right.
30% of the population is at 1 to 80.
Right. So I think that's a case where, part of this presentation was supposed to be about prevention, but if we early detection and early treatment, we can probably prevent when we see things like that, even sneaking up at all. But you're right. How do we run reference range lab tests? We take a random slice of the population and create these particular ranges. But I think that's where it's the art of medicine, where you can't really treat lab tests. You have to start treating people, and if there's signs of inflammation and symptoms of inflammation, and especially if it's on borderline, and I see antibodies all over the place. And for me, even if it's up a little bit, but I see antibodies that you can't even measure. It's like greater than 900. The lab couldn't even measure, right? And so we know they're in a world of hurt, but even if there's 300 or 29, we have to at least take steps.
Right, it's not normal.
Yeah. Do you know Jack Wilson? He's an integrative cardiologist. He's the guy that I heard leaky heart from. But it's that same sort of concept as, where we're thinking about Alzheimer's and cognitive decline in the brain and leaky brain and bladder disease and recurrent urinary tract infections, when everything from a genital urinary perspective is looking just fine. We're thinking about that bladder mucosal being somewhat similar to the intestinal mucosa, and it being leaky or hyperpermeable. And so that bacteria, fungus are being able to get in there as an opportunity and colonize and create havoc.
I think if we see a patient who's not necessarily symptomatic and they have slightly elevated antibodies, we're in a unique position to be able to prevent, the type of damage that's going to occur later on with an autoimmune disease. We're seeing the iceberg under the ocean level. I think it's so important to intervene in that state. I just did a podcast and we were talking about fatty liver disease, non-alcoholic fatty liver disease, and there's no symptoms. It's usually not diagnosed. It's probably 30% of the population because it goes with obesity and overweight, and all you'll see is their liver antibodies, instead of being 40, they'll be 45. And, it's okay, it's only a little bit elevated, don't worry about it. And then it can progress to liver failure.
But, and if you test, what do you see? Their glutathione is in the toilet.
Right.
And
GGT.
Yeah,
right.
Exactly. So, yeah, and what demographic is on the rise as far as non-alcoholic fatty liver disease? Children.
Yeah.
Sugar.
Sure.
Yeah.
I'm just wondering if you would be willing to share the slides.
Sure.
Wonderful. You can give them back and you can post them to the group.
Yeah. Or you can email me at drholly, Dr. Holly,
Okay. Wonderful. At
drhollylucille.com.
Dr. Holly at drhollylucille.com.
Yep.
Thank you.
Hi, thanks for the presentation. You were great.
Thanks.
Is it very common that you see patients with multiple autoimmune diagnoses? I mean, is that
It's like the thing.
rule rather than the exception?
It is the thing these days, and it breaks my heart.
And any particular ones that you find go together frequently?
I would say lupus and Hashimoto's, and rheumatoid arthritis and Hashimoto's. Hashimoto's seems to be like bang.
Yeah, that's the number one autoimmune disease.
Yeah.
Except now that IBS has an autoimmune origin, that may end up being the number one.
Yeah.
Could you repeat the name of the lab that you use for cytokine testing?
Yeah, we, it's the diagnostic.
Diagnostic testing has a new urine test for
Diagnostic
cytokines.
testing or diagnostic?
Diagnostic solutions, sorry.
Diagnostic solutions.
Yeah.
Thank you.
Yeah, the same ones that do the GI map.
And but previously I would, I'd pull together just from Quest or LabCorp and just, sort of understand the TH1 and TH2 from that perspective.
Yeah, I wanted to commend you on your presentation. I was wondering, what tests are you using for leaky brain and leaky gut?
Oh, so for hyperpermeability, there's the lactulose testing that is there for sure that you can do. But if there is a degree of dysbiosis through other GI mapping or whether it's the gut zoomer from Vibrant America, whether it's the GI effects profile from Genova, if there's a degree of dysbiosis where there are, I kind of call it a frat party going on, then I know that there is hyperpermeability. So I don't go ahead and test for hyperpermeability. I just treat zinc, carnosine, glutamine. I go through that whole protocol of the 4 R's, just repairing, removing, re-inoculating, recovering, and repairing.
So how do you know when you've cured them? What are the parameters you use for your outcome?
How you feeling? And mostly it's through. I don't catch myself repeating stool tests. I catch myself repeating antibodies and inflammatory markers because that informs me most. The person is my best diagnostic feedback, and then but I think when we do the job, and I've been doing this for so long, I just don't spend their money that way.
Right, Zonulin is supposed to be an indicator.
Zonulin as well, that as well.
Right.
Yep.
My other question is concerning Hashimoto's thyroiditis.
Yes.
Have you seen that in association with gluten intolerance?
Oh, 100%. The number one, if somebody was going to a deserted island and they came in with a Hashimoto's diagnosis and said, okay, Holly, there's only one thing I'm going to take with me that you tell me to do. I'm like, you have to avoid gluten 100% for at least 60 days. And the studies are there. I mean, it can reverse, it's there. So gluten sensitivity, gluten allergies, 100% gluten-free. And people try to get away with it all the time, and I know that their antibodies are not going to come down.
Right, but even after you do the gluten-free diet, and I actually have gluten-sensitive Hashimoto's thyroiditis. My antibodies were like off the chain.
Right.
My thyroid peroxidase antibodies were in the 1,000.
Right, that's...
I went gluten-free and they came down to like 200, and I decreased all the medications, but I'm still requiring medication, and I still have some positivity in the TPA, thyroid peroxidase antibodies.
Right. So other things like myeloinositol, I think there's some great studies, N-acetylcysteine. You could think about zinc, selenium for sure, driving those antibodies down. Selenium, I kind of push it, 400 to 800 micrograms a day, until I see in plasma that we are pushing it. But myeloinositol, I think, is important. I think N-acetylcysteine at 600 milligrams, maybe 3 times a day, is also important things to think about.
Sometimes, especially today, people are not eating iodized salt.
So I do the iodine.
Yeah, the iodine conversation you and I have had before, but it's a very important one because there is, I think, iodine deficiency that is rampant. And here's how I deal with that. I know it wasn't a question, but I'll just make one up and then tell you the answer. This is where I've had success because I do want to recover iodine. My experience clinically has been, because making thyroid added the thyroid level it creates a lot of oxidative stress. It does. My experience is if we get the oxidative stress levels down and increase the antioxidant status, you can then bring on iodine and it does not spur on an autoimmune reaction. And that's it. So plant-based antioxidants, vitamin C, lipoic acid, glutathione, all that stuff on board, bring the oxidative markers down, then start slow and low, but go with iodine, and it starts to be, but that's the art of it right there.
Okay, do you find
That's great clinical growth.
Yeah.
Do you find there's a big link between MTHFR and autoimmune?
I do. I mean, it's a really important thing. Another, you've got like content up the wazoo for this entire year for your Thursday nights because it's a whole other, I think, thing that we should talk about. Because I think from a consumer perspective, once again, and from my patient's perspective, if they get a hint that they are undermethylating because they've got a variant of MTHFR, all of a sudden, guess what? They end up overmethylating, and they can end up just as, in a world of hurt, just like they would be undermethylating. And so there are lots of nuances, I think, to treating epigenetically and nutrigenomically with that. But I think that's a really important piece.
Yeah, Kara Fitzgerald has talked a lot about overmethylate can actually increase your risk of breast cancer, so more is not always better.
Yeah, I know, right? Here, take this.
I saw in one of the slides that you tested DHEA. I was just wondering what that's connected to that you've seen.
Yeah, so DHEA, in my opinion, obviously an androgen, pre-circulated testosterone, but it's also what? It's an adrenal hormone. And so, and quite honestly, in adrenal dysregulation and HPA axis dysregulation, the number one hormone to go first down is DHEA before cortisol. And so you'll start to see that plummet. So that's
Use the new CARTA testing.
the cortisol awakening response. That's kind of new stuff, but that's pretty hot. Use Dutch testing for that.
Everybody familiar with cortisol awakening response? How many people do salivary cortisol testing?
Yeah, the salivary 4-point DHEA. There's nothing like it. You can get a lot of information from it. But then, of course, adding the cortisol awakening response, I think, just gives us a little bit more of a response.
Yeah, so your basic cortisol salivary testing, you're doing 4 samples. The cortisol awakening response is you need 2 additional samples. They have to do a sample before they get out of bed within the first 30 minutes of awakening, and then 30 minutes later. And so it's basically that first initial, as your cortisol shoots up as you wake up, is an indication of your ability to respond to stress. And that's the cortisol awakening response.
Do you ever see DHEA that's high?
Yeah, mostly that comes with supplementation.
Oh, too much supplementation?
Yeah. Or supplementation. Can you come over on this side?
Just a couple of things. Okay, so you had mentioned zinc as part of the protocol for
Zinc carnosine.
zinc carnosine.
Yeah. So great for healing the gut.
It's a combined.
It's just zinc carnosine. You can get it in a little capsule. Integrative Therapeutics has it.
Thank you.
Okay.
Everybody.
Because I thought zinc boosts immunity.
Yeah, zinc as well. 100%.
So why would you do that with a patient with an autoimmune disease who already has hyperactivity?
Zinc carnosine in the form of zinc carnosine actually not clear right now. We could get back to as far as the mechanism of action, but we're not looking to increase plasma levels of zinc in that way. We're targeting the gut.
I think there may be a misconception. I think that there's this concept that if you either have an underactive or overactive autoimmune system, and so if you have an overactive immune system, you get an autoimmune disease.
You don't export it.
Right. And if you have an underactive immune system, you get infections, but it's really not about that, right?
It's not clearly about that. It's not directly about that, and I really appreciate your line of questioning because you're right. If you have an overactive immune system, why would you want to stimulate your immune system with something perhaps like zinc? If you were feeling like something was coming on and you'd go to the cupboard and grab some zinc or vitamin C, you would want to increase your immune system. But I think that there are deeper things at play, and it's not so directly oriented to things like that. Because once again, zinc is an important mineral. I mean, it's important in thyroid, in all of the thyroid processes. Selenium as well. Our soil is deficient in so much of these things. That if we have a degree of hypochlorhydria, we have an increase in malabsorption of our trace minerals. Molybdenum is so important for all of these things that we're talking about. And so, not a really direct correlation there.
And by the way, testing for vitamins is not easy. It's not as easy as just getting a serum zinc. Because
it's unreliable from a serum perspective, in my opinion.
It is, and I think that some people, sometimes, well, I had my zinc tested. I had my calcium and magnesium tested on my, standard metabolic profile, but that doesn't mean anything.
No, I mean, especially when it comes to like the B vitamins, the water-soluble vitamins. I had a lovely gentleman who, in like, post-World War II, was in a foreign country and they accidentally took out his entire stomach. And so if you don't have intrinsic factor because you don't have a stomach, you really can't metabolize vitamin B12. And he needed vitamin B12 supplementation. We just knew that. But his doctor wouldn't give it to him because every time, because he was supplementing sublingually, every time he tested him for vitamin B12, he's like, well, you're too high, your levels are too high. I'm like, that has nothing to do with it. It's not what's in the cell. It was just what was in his bloodstream. So.
By the way, Metagenics offers a zinc tally test, which is, a certain amount of data behind it, that it's a functional status of zinc in your body. So you drink this zinc solution, and then you're supposed to have a metallic taste, and if you don't, it's an indication you don't have enough zinc. And, that's the thing. You may have a certain amount of zinc, but maybe your body's not utilizing it. So that's the key factor. And that's why we have tests like SpectraCell and the Genova Nutrient Valve to try to test the functional status of these nutrients in your body.
And another quick question. Can you speak about, with regard to food intolerances and the antibody testing, and because I've been hearing conflicting things about the protective ability of IgG and that it's preventing an IgE reaction, but really that it's the IgG4 that is more protective. Have you heard that? Or maybe it's IgA. One of those two, that they're protective, but if you have too much of it, then it can cause problems. But it's the IgA4 or G4, whichever one it is, that really is protective.
I don't know if I can speak to that.
Maybe one of the lab, you said Spectral is here?
Spectral is here, yes. Jillian. Gillian, sorry. Gillian.
Because it's kind of a controversy. Rheumatologists will say that it's okay to recognize
maybe what you're saying is I think that it's, and from my experience, and maybe this is what you're saying and maybe it's not, but from my experience, when I look at more of the conventional testing, or even in the literature, it's the IgE that they're testing. And IgE is, it's like, okay, peanut allergy, you're gonna take it and you're gonna have an anaphylactic reaction. Like, there's very few people, because I can do testing across the board, that come up with an IgE, deficiency there, but it's the IgG and the IgA where there's delayed sensitivities that we need to understand about, and that is very helpful in decreasing. I'll just give you this example on my own. I had a testing lab that was under new management, and they wanted me to start using them again, so they sent me this. This is the second time in 3 months that I came up with an IgA and an IgG profile where eggs and egg whites were, I'm just firing high. And I have this very weird atopic, I just thought it was atopic, right? So I was like, okay, this is crazy. I eat an egg every day, and I said, so for 3 months, I'm not gonna eat any eggs. And guess what? I have not eaten an egg, and I have not had an itching spell since. And it was the only thing that came up. And so part of me was like, okay, yeah, I'm sure I've got a degree of, I need to continue to heat my gut, but, it's like everyday process for what we go through. Cortisol being an inflammatory hormone, stress being involved, even if it's eustress and having a great life and stuff like that. But So I think those tests are really important and they inform us. And if we can get those, triggers, it's part of the matrix is just getting those triggers out of there and stop firing that inflammation. It's extremely important. So I'm sorry if I didn't answer your question. You can always contact me. We can figure it out together.
Yes, you mentioned molybdenum, and I was wondering if you had any experience with molybdenum and vanadium and multiple chemical sensitivity.
Say it again?
The relationship between molybdenum deficiency and vanadium and multiple chemical sensitivities.
Oh, well, sure. First of all, molybdenum, vanadium, all of those things, I can't even go through how much of our biochemistry they inform. It's like when you take a nutrition class or you take a biochemistry class, it's taking a nutrition class. And so multiple chemical sensitivities, what are we doing? Like I always say that you can't point your finger at the, it's like anything else. If you're pointing the finger at somebody, you've got 3 pointing back at yourself, right? Like they did it. If you're pointing the finger at an antigen or something you're responding to, I still think it's important that you're pointing back at yourself because we have to understand why the body is reacting. So nutritional deficiencies in and of themselves play a really important part in all of that because if molybdenum is not on board at an optimal level, then you don't have your detoxification processes open the entire way. And so recovering those are extremely important, and then could completely contribute to the diagnosis of multiple chemical sensitivity, for sure.
I actually use them to eradicate my multiple chemical sensitivity.
Yeah. So
and I just did it by reading because this is when I didn't really know very much about alternative or complementary medicine. Back in the early 2000s, I had really bad. I couldn't even walk down the aisle, perfume aisle.
Well, you look like you're doing great. So
yeah.
Congratulations. Nice job.
I've been through allergy testing a number of times, but not in like the last 15 years. So the last time, they said I was allergic to strawberries. And it's like, no, I'm not. Because I can eat a whole basket of strawberries and have no problem. So it was the only thing on the list that wasn't right. How could that come up like that?
Yeah, it all depends. It's a great question. It comes up, right? So you can ask for verification of the lab credentials and certification and all that stuff. Or sometimes we're the walking wounded. Sometimes you might be eating strawberries and you say you have no problems, but you don't really understand that you don't have any problems until you avoid strawberries for 3 months and say like, oh my gosh, I feel fantastic and I didn't know I could feel any better.
And then you add them back and you feel better.
And then you add them back, yeah, that's the whole elimination
I've
thing.
been on a number of occasions, right, for various things.
All right, I don't have a good answer for you, I'm sorry.
That's okay.
Anybody else?
Do you have an opinion on macronutrients?
Question is about ratio of macronutrients.
The ratio of macronutrients.
Like paleo or...
Yeah. So I am in love with macronutrients. I think they're all very important. And I don't think any one of them should be disregarded at all. I think it's just that when it comes down to the ratio, I actually just think it's the quality and the combination. That I think carbohydrates, proteins, and fats are extremely important. If we're on an AIP or a ketogenic, obviously that's going to be skewed from a fat and protein perspective. But plant strong, if we're plant strong, always we're going to be nutrient dense, and that's always what we're looking for when we talk about these certain issues. So I don't really have a ratio, and everybody's so different. I do have to say, though, the best success that I've had when people's back are against the wall and their antibodies are firing over 1,000 or so is the autoimmune paleo diet and just eliminating all of that stuff.
And then you had said no grains. What about pseudo grains like quinoa?
I don't. It's a great question, and for the first 60 days, I just have them eliminate them, period. And then introducing them back in, once we start having those numbers come down, is an option. And then, of course, with everything, whether it's plants that we're sourcing, whether it's animal products that we're sourcing, whether it's grains that we're sourcing, they just have to be as clean as possible.
Why do they have to do all this stuff? Couldn't they just drink celery juice?
That whole craze has been a very profitable thing for me. I've had people come in like, well, I just started drinking celery juice. I don't even want to go there.
They do make brainless tortillas there. Out of almonds and cauliflowers.
That jogged my memory when you said about diets. Do you ever use the elemental diet to bring antibodies down, or just to bring inflammation?
Yeah, I mean, the elemental diet, once again, adherence is pretty, you have to do a lot of education on that. It's a perfect diet for SIBO, and that is definitely something that, my experience with SIBO is if somebody is SIBO positive, it is so important to eradicate that. I have to say that I have tried it both ways, but the antibiotic route is usually the way to go. And our job is to make sure that we identify and treat the underlying causes and have it not come back. So the whole, MMC and making sure that there's intermittent fasting going on and keeping those bacteria away from that upper GI tract is so important. But the elemental diet, I think, is really, really strong for that.
Thank you, great presentation. You mentioned again going off of gluten for 60 days. Someone with multiple autoimmune issues, how much longer or indefinitely?
Indefinitely. Yeah. I mean, it would be my choice. I have to get a buy-in initially. Yeah. I mean, it just doesn't make sense in our country, the way that it's, I think it was back in the 60s where they started genetically modify our wheat into something called dwarf wheat, where it decreased the nutrient value, increased the glue part of it, and it just doesn't make any sense. And the glyphosate is a fuel for our autoimmunity. I mean, I think that's what's happening mostly. And it's just best to avoid it, and it's the ultimate of do no harm. I mean, once we get things under control, what I tend to do with people is talk to them about their health bank account. I call it their vein bank. It's like, obviously if they're seeing me and they're in a world of hurt, they're in debt. How do you get out of debt? You make more deposits than you do withdrawals. So how can I create and help them create deposits? And then how can I help them identify their withdrawals? And so they're going to say to me, well, how long do you think it's going to take for me to feel better? And I'm like, it all depends on what your bank account looks like. Because then a lot of people get up to just paycheck to paycheck, and then they blow their entire wad, and then they come back down. And so I'm like, look, I want you to be up here where you can afford your withdrawal, where you can afford that piece of cheesecake, where you can afford that baguette or whatever it is that you want. I want to vary your palate again, I do, but you can't afford it right now. And that's kind of how I talk to people.
Yes, I've heard a lot of people use the barrel analogy, which is that you have this barrel of different things that overstimulate your immune system, create inflammation, and when the barrel is close to filled, all sorts of things are going to allow it to spill over and into symptoms. But if you clean out that bucket, get half of it empty, then you get away with things that create a little bit of irritation or inflammation or activation of your immune system and not have symptoms.
But that's why I think in our modern age it's getting harder and harder and harder because of our environmental influences for sure, and then all of the different I mean, I test for Epstein-Barr virus because I think it's so important because I just see it so often, and I think it's really important to treat. Once again, conventional doctors, I think they're not going to do anything until you have to rest. But I think we can get antivirals on board. I think that we can can do the whole shebang, but it's important to understand what's going on. And then if people have multiple infections, especially like tick-borne illnesses and co-infections, and you have to look deeper for what's going on with the immune system, whether it's autoimmunity for sure, or if there is an immunoglobulin deficiency. I have run into that over and over again. So I am testing IgM, IgA, just to see if there's a deficiency. I think it's extremely important because once again, you ask the question, why aren't you able to fight off these things that we live amongst all day long, all the time? Why are you otherwise a 37-year-old healthy man and you seem to be overtaken by infections? And so the questioning just has to go on. The body is meant to heal itself. It's there to support you. It's always wanting to come back into balance, that homeostasis, but why is allostasis at play again?
So if your IgA or your IgM or your Ig anything is low, how do you treat that?
I call it immunologist. I do. I call them and I make sure they call me back, because that's the first sign that it's going to be a good referral, unless I have a referral. I mean, honestly, and then I talk to them about the case, tell them my experience, tell them my scope of practice, tell them what is not my scope of practice, and I tell them I want to refer them to somebody, and they usually go to immunotherapies.
When Dr. Aguirre was here, he talked about using peptides that help strengthen the immune system.
Sure.
BPC 157.
Immunopeptides, sure.
Which is now being sold as a supplement.
Yeah. Well, thank you.
Excellent.
So
Thank
much.
you so much, Holly.
Thank you.